All right, we're just a couple minutes past the hour, so we will go ahead and get started. Welcome to the Wellness Education Benefit Training presented by the Department of Healthcare Policy and Financing. My name is Carly Altman. I work here at the department, and I'll be giving you the training today. We're scheduled until about 1:30. I'm hopeful to get through our training information in the first hour and then leave some time at the end for questions. A little housekeeping before we get started. You'll notice that the chat is turned off. That option is turned off for you right now, but we do have the option for Q&A. That's a different option at the bottom of your screen. There is a box with a question mark in it, and underneath it says Q&A. You'll be able to use that Q&A function throughout the training to ask your questions. We'll leave time at the end for you to be able to raise your hand, come off mute, come on camera, and ask verbally your questions as well. But we do ask that you use the Q&A function throughout the meeting. If you have a question that comes to mind and you just can't wait till the end, you might not see an immediate response to that question in the Q&A, but I want to reassure you we are capturing those questions and we'll walk through those questions at the end of the training presentation when we have our questions time. Everybody right now is muted and I believe your cameras are off, but you can raise your hand when the time comes to ask your question. You can also put your question in that Q&A box and we'll be tracking. With that, before we go into the material, I know that some of you are familiar with the Wellness Education Benefit as it was released to CHCBS waiver members last year. I just want a quick thumbs up if you're somebody who is familiar or heard of the Wellness Education Benefit. Thumbs down if this is the first time you're learning about this benefit. All right, we have a good mix that I'm seeing come through between thumbs up and thumbs down. That's really great. For those of you that are thumbs upping, take this opportunity to rehear this information and pay attention to some of the differences. There's a few nuances as we're rolling this out to all of our waivered members. For those of you with thumbs down, it looks like there's at least one person or a few at your agency who has experience with this benefit. So reach out to them, work with yourselves after we go through this training. You've got resources within your agency as well. All right, let's go ahead and jump into our content today with a couple objectives for our training. We're here to learn what the Wellness Education Benefit is and why it was created. We would hope that by the end of this training, you will be able to explain the benefit of the Wellness Education Service to members in the community, to learn about the enrollment process, what you'll need to do as a case manager to ensure that somebody gets enrolled into this benefit in their waiver, and be able to share information about the benefits of having this service are with the member. To start, we'll explain to you why the web was created. And I did ask who's familiar with this service as it was rolled out to CHCBS to start, because that's a big component of why we created the Wellness Education Benefit and why we're going to go ahead and expand access to that service to the rest of our waivered members. In May of last year, it was originally created only for CHCBS members, and that was because we were also going through a process called case management redesign. Within that process, we were moving case management from a service item in CHCBS to administrative case management that we have for the rest of our waivers. What that did is leave some members in the CHCBS waiver without an actual waiver service. They weren't receiving IHSS, just case management. They did need to have a different service in order to maintain their waiver eligibility. And that's where the Wellness Education Benefit comes in. It's really a service that provides educational articles and materials that are targeted to members so that they can learn about health and wellness and have information that's pertinent to their goals. The web, we'll take a look at what the web is here in a couple of slides, and we'll show you some examples in the presentation. But really, a member may be interested in receiving articles about managing their health and wellness and having this information, because these articles are going to help increase their health literacy, help them manage their health-related issues, potentially prevent hospitalizations, and really promote community living amongst our HCBS members. So with this expansion, we're going to take the wellness education benefit that's already available to CHCBS members as a waivered benefit and make it so that any member that's in any of our other waivers can access this waiver benefit. Let me give you a little bit more information about what exactly the web is. In theory, it's a little bit self-explanatory, right? Wellness education benefit. We're educating folks about wellness, and it's a benefit on our HCBS waivers. At the heart of the wellness education benefit, it is individualized educational materials that we use HCBS member data to target and individualize the information going to a member. It's a monthly waivered service that's mailed to the HCBS waiver member. That is the service. It's a mailed document that they would receive on a monthly basis. It's really important to think about it as a monthly service because we know HCBS waiver members require to have one waivered service a month at least. The wellness education benefit articles are really simple. They are about practical health and wellness practices for a member, and we do look to them to promote community living for adults and families and children. And one of the really cool things about this benefit is that it's available in multiple languages. You may have a member who Russian is their spoken language, written language. That's how they read and understand information. And this wellness education benefit can be provided to them in that language so that they can have optimal utilization of it. It's also available in Braille, which is really neat. We haven't been able to offer a benefit like this in the past with Braille, so I'm very excited to share that. We have had some questions about the opportunity for additional languages to be provided as we expand this benefit out to all of our waivered members, and that's a wonderful point. I think we are always welcome to take some information back, some suggestions about different languages, populations that you serve, so that the department can determine the capacity that we have to issue out these wellness education benefit materials in alternative languages. But for right now, those are the languages that it's going to be offered in that you see on your screen. When we've working to create this benefit, we have definitely established some standards of practice so that the material can be the most useful for members. Each one of the articles is going to follow these requirements that we've set up. They're going to be brief, 350 words max per article, really so that we don't overwhelm the reader and inundate them with too much information. We've made a concerted effort to make sure that the information in the articles is person first, it's in plain language, and it's solution focused so that a member can read this information, access this information, and feel like they have an actionable item at the end, something they can do to increase their health, their wellness, or just their knowledge of how they can navigate through the Medicaid system. One other really neat factor about the wellness education benefit mailings is that each of them has a QR code that can be scanned, and it's going to give that member the opportunity to access the information in a digital format. So they don't only have the hard copy mailed version, they can scan that QR code and see the exact same information on their tablet, on their phone, on their smart device. They don't have to use the QR code if they don't want to. Maybe they're not sure how it works. It's just not for them. They'll have that physical mailed document and it looks exactly the same. The web is going to come as a bifold document. It'll arrive in the member's mailbox with the first external side containing their address information. The other external side will have the generalized article about something like tips for better sleep or sun safety, ideas for having a balanced diet, some very general information. But then the internal article of that bifold is going to be more targeted to your member. For example, it might have information about how to help somebody quit smoking or how to navigate through state plan benefits, something that would actually apply more specifically to the member. I'm going to show you a couple of examples of the wellness education benefit articles, but before we do that, I'm going to let Rachel show you visually what that wellness education benefit looks like that your member would receive in the mail. It's nice to have a good visualization.
Yeah, hi everyone. I'm Rachel McLeish. I'm with HICPA. So this was the very first web I received. You can see this is just the front page. We'll have the member's address. And then the flip side will be a very generalized article. You open it up and it's upside down, but you got two additional articles inside. We had not had the QR code ready just yet for this initial one, but all of our future webs and current webs have a QR code that you scan and it will show this exact same information. And someone mentioned asking about the digital format reading to the member. It's compatible with screen readers. So the QR code itself doesn't function to read it out, but if members are using screen readers, they are compatible.
Awesome. Thank you, Rachel. Yeah, that's a really important component of that QR code and having the hard copy and that digital copy so we can make it more accessible for all of our members because we know our members have varying levels of ability to take in this information and receive this information. You can't opt out of receiving the hard copy though in lieu, and just to receive the digital copy, you're going to need to have the hard copy in order to get that QR code to access the digital copy. On your screen now, this is a example one of the article. It's just the introductory article about the wellness education benefits. So all of the members who get enrolled into this service are going to get an introductory article that looks like this, and it just gives them that general explanation about what the wellness education benefit is, that you'll be receiving it regularly, some of the information that a member could expect. So just one example about what they'll receive first in the mail. After they get their first one, we have an example two that's more targeted towards a member's care needs, their goals that have been identified. This example is about state plan and waivered services. They can read through this and you'll notice this example here has some additional links that are in the article. We don't want to overwhelm the readers by any means, but some of the articles do hold a lot of information. And so when that's the case, we'll also provide additional resources so that they can do more research if they'd like to. They can click the link through the digital version. They can type that link into their computer to go to those websites and kind of dive into that nitty-gritty pieces of information on the topic. Each article is also paired with a photo. If you've noticed that, we've got great graphic designs in there and photos to keep the articles interesting. Article 3 example. So this is the one when Rachel just showed you, you saw that purple banner at the top. It's got Health First Colorado on it, and it says wellness education benefit, and then has that QR code. This is how we're hoping visually that members will recognize this is part of your HCBS waiver service delivery. Once you've enrolled into the service, it's coming from the department, from Health First Colorado. It is your wellness education benefit. And this article too, you'll notice is a lot more specific. It's about sharing your worries about school. It's targeted to a younger individual that maybe is going through some transition times. And hopefully that this type of article can prompt some conversation for that family, for that member. Maybe they need to reach out to additional resources in their community, but really targeted to encourage that discussion of what members might be going through with their health and wellness. The wellness education benefit has a lot of member and community benefits. Again, this is an educational service. It's monthly that is coming in the forms of articles, and it really can allow for continuous conversation about specific health and wellness issues that somebody might be facing, and potentially be the difference between a member prompting themselves to reach out to a primary care provider or another community resource and not doing that. It can help members maintain their waiver eligibility, of course, because it's a monthly waivered service. And this is going to be particularly important as we as a state move through new initiatives that are coming in the coming months. And we'll talk a little bit about that in the coming slides. But at its core, the wellness education benefit is designed to help improve the members' health literacy, help them navigate through Medicaid resources by giving them health information and contact information. And then we also do see some additional indirect benefits based on the type of article that a member receives. It can help them combat social isolation and develop social support networks as well, which we know we've got health equity concerns across our state all the time. That's always an issue. And this is just one more tool that we're going to be able to utilize to help address some of those disparities. For example, we might have an article sent to a younger adult that's tips for job interviews as they're going through transition aging. There might be an article that is targeted towards older adults that is talking about tips for fall prevention. One of the neat things too about this benefit as we expand it out to all of the populations we serve across the state is that the ability for our vendor who's creating these articles and distributing these articles to target the information is going to increase as this benefit is utilized by more individuals, because they'll be able to hone in on more targeting factors to determine which article is sent. And this is important for you as a case manager to keep in mind, because the more specific that you are in documentation of your members' goals in the care and case management system, eventually the better targeted information we'll be able to have to get the correct information, useful information out to members. You might be thinking, that's a lot of information that you guys are tracking and using to target these articles, right? We're looking at age, location, member information, and their care plans and their goals. What's happening to all of that information? I want to be able to assure you that the data transfer between the department and our systems and our vendor who's mailing these articles out and helping with the creation of these articles is HIPAA compliant. We work with a vendor named SmartSource. That's the wellness education benefit provider, our vendor provider, SmartSource. And they've been doing this with other states in their own versions of the wellness education benefit for years, and has been our vendor provider for this benefit to the CHCBS members for almost a year now as well. So we're working with them really well and effectively over the past year, and excited to expand this benefit out to the rest of our waivered members. We provide data to SmartSource each month that they use to identify which articles will be useful for each member. Once the targeted articles are identified, SmartSource gets rid of that data. They're not keeping it, they're not distributing it. And we have all of that HIPAA compliance associated with that data transfer. They're also keeping a record of all the articles that an individual member gets so that members are not sent the same information over again throughout the year for their monthly wellness education benefit. The wellness education benefit is truly a dynamic communication tool for our members, and we'll be able to create articles in real time to communicate information from the department or state changes to help keep our members informed and in the loop of all of this information coming out. A good example of this is the state of Washington has a wellness education benefit in their waivers as well. And back in 2020, they used the wellness education benefit to communicate COVID updates directly to their members. And that was a really key tool during that time to make sure that members were receiving information accurately and timely and getting informed. This benefit can reach people who may be socially isolated, again, that maybe live in rural areas. We know not everyone has the internet. Not everyone has a smartphone device that they can use to access information. And so utilizing the wellness education benefit is going to be a direct form of communication for them. And it might be the only way that they are receiving some of this crucial information to help them navigate through our Medicaid systems or navigate through their health and wellness journey and some of the health conditions or things that they're facing on their daily life. So I hope that gives you a really good understanding of exactly what the wellness education benefit is, right? It's coming in that mailed form in the mail to the member, monthly health education information. The reason that we're giving you this training here, and I want to touch on something called Community First Choice, because it's really important to understand the utility of the wellness education benefit for all of our members in the context of our new initiative, Community First Choice. And that's an optional Medicaid program that allows states to offer some of our home and community-based services and supports to eligible members that are eligible for state plan Health First Colorado. And what that does is allows us to expand our long-term care services to more Health First Colorado members. CFC is going to be implemented in July of 2025, and we're going to have more training for you on CFC. I do want to keep the focus of this training on the wellness education benefit just as a newly available benefit to all of our HCBS waiver members. It's a new waivered benefit going to be available to all waivers. We'll go more into CFC in coming training, so hold tight on some of those CFC questions and information. But in the context of CFC, the wellness education benefit is going to be an important factor to help ease the transition from waivered services to CFC services for some members. Any member that's enrolled in a waiver right now is going to be considered eligible for CFC. And waiver members will still be able to access the remainder of their waivered services in addition to services under the CFC program. But there is going to be a transition time where we're moving those services from the waiver into CFC. And we're going to go through an example of what that might look like for a member here in the next slides. But it'll help highlight to you why it is important and why we're allowing this wellness education benefit to be implemented prior to CFC, so we can set ourselves up for success in the future. The CFC services and service delivery models that are going to go from the waiver into CFC are listed on the screen. And you might be looking at the screen and going, well, gosh, I have some members who are accessing those services and they're only accessing those services, not accessing any other additional waivered service. Maybe they just have personal care. We'll walk through a scenario here in a minute for what that looks like, but keep in mind that these are the services that are going from the waiver into CFC. If you have someone who is only accessing personal care, for example, they would have that service go into CFC. Their waiver would not have a service on a monthly basis. Well, we know we have a requirement Every waiver member has to have a service on that monthly basis. If they don't, you have to work through that closure process. But if you go ahead and add the wellness education benefit to their waivered program, they will have a monthly service, and that transition for personal care to go from the waiver to CFC will be a lot easier and smooth sailing in the future. Again, we'll go over those services in depth in future trainings. So members are, again, required to have at least one waiver service on a monthly basis to maintain their eligibility. And it may be that somebody wouldn't have a waiver service if they don't actually enroll into the wellness education benefit. So I'll give you an example here from that list of services. If person is only receiving personal care and that service transitions from being a waivered service in July to being available under CFC, then a member who is receiving personal care as their only monthly waivered service will have to start receiving that personal care under CFC when they transition at their continued stay review. So if that happens, they have a couple of different options. They can either disenroll from their waiver completely if they qualify financially for Health First Colorado benefits without their waiver. They can access personal care through CFC only. Alternatively, they can access and utilize the wellness education benefit as their new monthly waivered service, and that allows them to maintain their waiver eligibility and therefore their CFC eligibility, and they'll get their personal care through CFC. They can also choose another waivered service aside from the wellness education benefit if they have a need for that service. So while you're going through your service planning process, you will be having these discussions with a member to determine, hey, what are your needs? Is your service moving to CFC or not? Let's go ahead and add this wellness education benefit to your service plan, and that's going to help ease the transition to CFC when the time comes. And I don't know if our slides are stuck, but we've gone on to the example slide. Thanks. I'll leave that up there for a minute so you guys can read through that, but that's the example that I just provided you. So keep this in mind. Wellness education benefit is being implemented prior to CFC. So again, today we're just going to focus on this wellness education benefit and the enrollment into that benefit. I'm going to share some timelines with you later on in this presentation so that we can kind of put things together. But know that wellness education benefit is going to be a crucial factor for some of your folks as we move through to CFC later on this year. For enrollment, pretty straightforward as far as enrollment into the wellness education benefit as it relates to how you might enroll somebody into any other one of your HCBS benefits. It's going to be available as an HCBS waivered service effective May 1st, 2025 for all waiver members. That means that you'll see the wellness education benefit service option in the bridge starting in February. February is just a couple days away. So just next week, when you're doing any sort of continued stay review, service planning steps, and developing your PAR, you will be able to see that wellness education benefit as an option. But it is key to remember that you cannot have an effective date for it before May 1st. Some of you might be doing CSRs next week that have that May 1st start date, and that's why it's going to be available in the bridge starting next week. You will need to add the wellness education benefit to your PAR for your HCBS members. This is a slight change from what happened when we implemented this benefit for the CHCBS population. The department did some automatic adjustments on the back end of our systems to automatically add that wellness education benefit to those members' PARs. This time around, as we're offering it to all waivered members, we're not going to do the automation for you. You'll have to manually add it to their PAR and service plan the same way you would do for other services in your PAR creation and service planning development. After you enter the PAR, enter the web into the bridge on the PAR, it's going to get transmitted to the service plan in the care and case management system. And this is a screenshot here of the bridge. I hope you guys are familiar with the bridge and doing your service planning steps. But this is what it will look like. You'll need to add the web service to the PAR with effective dates and end dates. And remember that effective date cannot be before May 1st, but it can be any date after May 1st. And then your appropriate end date for your certification span. You'll want to select the wellness education benefit from the service dropdown, and the service code is 98960. You'll need to enter the units, which will be 1 web per month for a total of 12 if you have a full certification span. You'll also need to select at least 1 ADL or add a goal to the web PAR line prior to submission of the PAR. Once the web service has been added to the PAR, it'll be transmitted to the service plan in the CCM following the submission of said PAR. The R3, which is one of our interfaces, still sends goals from the care and case management system to the bridge, but a goal is not required to submit the PPA. So therefore, we won't see any more, shouldn't see any more B098 error codes. If the goal does exist in the bridge, it does need to be attached to a service for the PPA to submit. Otherwise, you might see a B050 error code and it will suspend your PPA. So as you're going through this enrollment process and service planning process, there's a couple of things you as a case manager need to be responsible for doing. You need to confirm your member's preferred mailing address and make sure that it's correct in the care and case management system. It has to be a current address or the member is at risk of not receiving their mailed wellness education benefit. You'll also need to be working to confirm their preferred written language in the CCM because, as we mentioned before, this wellness education benefit is available in multiple languages. If a member chooses not to receive the web, that's okay. But we do expect you as a case manager to ensure that they understand they must receive at least 1 waiver service on a monthly basis to maintain their HCBS waiver eligibility. And when CFC occurs later on this year, if their services move to CFC, they might not be receiving a waivered service at that point, and the wellness education benefit would be beneficial for them to maintain their eligibility. When you're going through this enrollment process, make sure that you're documenting all of the things you need to in the CCM. So using your activity log and the other steps that are already in place for the work that you do, go ahead and make sure things are documented effectively. If you're having conversations with the member about this, put it in your monitoring contact. If you're doing your enrollment service planning steps, make sure you're documenting effectively in the CCM. So preferred address, you should be familiar with this in the CCM, but make sure that this is the information that is updated in the CCM and it's accurate. And this is designed to say where the member is preferred to receive their mail. It could be a home address, a PO box, a different location, but you'll need the name, street address, city and state and zip code, and the county. The preferred address in the CCM connects with streamlined eligibility to allow for an interface from CCM and CBMS through Peak Pro to communicate that preferred mailing address. The toggles that you see on the screen are what you would see in CCM, and it's important that you make sure that those toggles are correctly toggled to primary address, preferred mailing address to be reflective of where that member's preferred mailing address is, if that's the case. When you update the address in CCM, it should be transmitting to other systems. It is important to know that when that transmission occurs, there is a flag on the CBMS side. That's where your county tech eligibility workers are. that asks them to go ahead and verify the address change. So there's a manual human intervention step that occurs there when an address change occurs. And so you might not see the confirmation change happen immediately, real time, because there are some checks and balances in the system to ensure that the information is accurate. A couple of things in CCM that you have to make sure are accurate as well when you're working through an address change or verification of address. You have to make sure that the zip code is entered. The member must have a 100.2 assessment in the completed status. And you also must have a program card that's associated to the 100.2 assessment. It can be in any other status other than closed. So if you have a closed status on your program card, we're not transmitting addresses or doing anything because it's not showing that that member's program is actually open and they shouldn't be receiving services at that point. So any other status other than closed. You might have to update addresses in the CCM, and that's okay. It might be something that you're familiar with doing already, might not be. We have a job aid that's for the CCM that can help you work through this. But when you are updating addresses, there's some timelines associated with that to ensure effective mailing of the wellness education benefit by our vendor. We are asking that you make sure you're completing updates for mailing addresses in the CCM by the first Tuesday of each month. There are going to be 2 monthly mailings of the wellness education benefit to ensure that new members receive their first wellness education benefit within 30 days. Members are only going to get one web benefit per mailing per month. But what we are able to do is do 2 different data pulls. So anyone who's added after that first Tuesday will get sent their wellness education benefit later in the month. They only get one, but this is kind of a catch-all to ensure that they get that their benefit within 30 days. They'll still just get one. So work hard if you've got an address change to get it done by the first Tuesday of each month. That'll make the process and receipt of the benefits much smoother for your member. If you don't have the correct address or you see an address that is system fed in CCM, you should be expiring the incorrect address in the CCM by entering an expiration date and turning the preferred and primary address toggles to no. We saw those toggles on the slide before. And then you'll be able to add a new address to input the correct address information and slide the preferred and primary address toggles to yes. And again, there is a job aid that is available to you for entering and modifying an address to utilize as a resource during this process. That is a job aid available in our Google folder where all of our other CCM resources live. And so you might be thinking, gosh, Carly, that's a lot of slides about addresses. And why is this so important? It's important because this is a mailed service. And we do have a process to track returned mail, but we want to do our best to make sure that we don't have returned mail. When we do, though, Healthcare Policy and Financing, the department, is going to receive a list of returned mail throughout the month. So we're the ones tracking that. You don't need to track that at your agency. Specifically, you're not going to receive the returned mail at your agency. The department's going to get that list of returned mail. And then we'll take that information and upload it to your case management agency SharePoint site. If you're an individual case manager, you might be saying, I don't know what SharePoint site is. That's not something I have access to. That's okay. I assure you, someone at your agency does, likely a supervisor or your manager. They'll be able to garner that information and distribute it out to you as an individual case manager. And we'll be notifying those manager supervisors of that update via email. And our expectation for you as a case management agency and individual case manager is to conduct member outreach to get that updated address. So if you get notified your member had a returned mail, we'll want you to be going in and looking to see, is this address updated? Do I have the appropriate contact information for this member? Maybe they moved and didn't tell you. Maybe something else is going on. And then we'd ask you to go ahead and update that address if you find out that there has been a change in the CCM, again, by that first Tuesday of the month. And that way they'll be able to be sent the next month's wellness education benefit. While returned mail is, we've got a process for it, having that address is super important. I do want to give you some reassurance over the last year that we've had this wellness education benefit active for our CHCBS members. We've only received less than 1% of the wellness education benefits returned through mail. And so we do expect those numbers to remain low as we expand the benefit out to all of our other waivered members. This next slide is a quick reference chart for you to understand whose role is what in this whole wellness education benefit process. We have a couple entities and players at the table. We've got the member, the department or HCPF, case managers, and providers. And this lists out sort of those primary responsibilities and roles for each entity there. A member is responsible for really indicating to you as the case manager that they want the wellness education benefit, that's something they're interested in and they would like to receive it. It's their responsibility also to ensure that they have an updated mailing address on file with you. They need to identify any accommodations that they might need and their preferred written language. And then also report any issues to you as the case manager. Maybe they think they should be receiving the wellness education benefit and they haven't received it in the mail. We want to make sure they're letting you know of that. That's something else that you might also be checking in on during one of your monitoring visits. And then there will be an automated phone survey that's conducted to members. It's optional. They might get that call, not know what it is. You can let them know it is coming from our vendor, but it is optional for them to participate in as a way to get additional information to the department and our vendor about the benefit, how it's being received and utilized. The department works really closely with our vendor to receive data reports and inform article selection. We do contract management, quality assurance steps with our vendor. And our provider is using that information to do service delivery. They have great graphic design, article translation, systems operations, quality reports to us, and they're the ones conducting that annual member survey. You as the case manager have a role as well. In addition to your regular case management responsibilities and roles, for this particular benefit, we're asking as it's new to our members that you have the ability to explain the benefit to them, what it is, why it's important, what kind of information might be available to them through these mailings, for you to enroll the members through that process that we just talked about. Update their enrollment if there's changes with their preferred mailing address or any other information. Maybe their language preference has changed as well. In order to help you complete your responsibilities as a case manager, I wanted to share with you some talking points about how the web is useful and beneficial. You can screenshot this slide, but we'll also have some information on our resource pages. But essentially, when you're talking to your member, you can let them know, hey, this is a benefit that's going to provide you educational materials regarding your health and wellness. It can also provide state resources and information, things about food, housing, state contacts, all of our great community resources out across Colorado. And it can act as an ongoing monthly service, which can help you maintain your waiver and financial eligibility in future states. Explain to them that they have the option to opt out from the wellness education benefit, or receive it, change their mind later, voluntary withdrawal from the service, never have the service put onto their PAR in the first place. But in order to get that information, you're going to have those conversations with them about the benefit. If they do choose to opt out or decide to later voluntarily withdraw from the web, then you need to make sure the conversation with them includes that concept of them having another monthly waivered service to maintain their eligibility. If they don't have a waivered service, you'll have to start going through that case closure process. In future state, when we move to CFC, it could mean that they risk losing their waivered services if they don't have a different service. So that conversation is pretty crucial in this process. With that, I want to conclude by reiterating our timeline for you all as case managers, what you can expect, and some key takeaways for you. So in February, right, just a couple days from now, the web will be available to add to the members PAR with a 5/1/25 effective date, not beforehand. In March, so the following month, we'll have our wellness education benefit information codified in our regulatory language. You'll be able to access that through the Secretary of State's website at that time to see the wellness education benefit listed in our array of HCBS services that are also available to members. And then in May, the web will be live and accessible to all the members, right? You have that 5/1 effective date on their PAR. That's the month that they'll receive their first wellness education benefit. Touching back on CFC, you'll also be responsible for adding the wellness education benefit to members' PAR for certification periods going forward from May 1st, but particularly in July, when we go through CFC, this is when the adding of this benefit will become pretty important for some of the members going through the transition to CFC at their CSR. So you can add it for anybody 5/1 going forward. That gives you 2 months to sort of get comfortable with the waiver, with the benefit, with adding it to other people's PARs that are going through their CSRs and not CFC transition yet. And that way in July, when you're working with members who are going to transition to CFC, you would have already gotten this practice with the web, getting it onto the PAR and adding it to service plans. That statement is not meant to say everyone needs to have it by July 1st, just that CFC starting in July 1st, that will also be done on a rolling basis throughout the year at members' CSRs. But wellness education benefit is getting to be available to the rest of your members starting in May, a few months early. So review and some key takeaways. Here, again, it's a monthly benefit. It's a mailed service that provides education materials to members. Web utilization will allow the members to maintain their eligibility. It's expanding to all members in May. And all current and new members will need to have the web manually added to their case manager. We're not auto adding it for you at the department. That'll be a case management task through your regular service planning process. We do have a lot of resources for you to access after this training series has concluded. We will have some CFC modules. We have the CFC website and additional resources. For contacts and resources, there is a wellness education benefit website that you can access. It's on our state public website, hicpufcolorado.gov/wellness education benefit. And then this training and additional resources will be posted to our long-term services and supports training website at the bottom under W. You can also submit questions and feedback or comments about the wellness education benefit to our community first choice team. And they have an email that is hicpuff_web or web@state.co.us. So I do encourage you to take a look at these resources, visit the CFC website and the wellness education benefit website to reread through some of this information and garner the additional information you want. Also encourage you to give us questions, give us feedback, tell us how your members are interacting with the web or any feedback they've provided to you once this is going live in May to that email. And with that, we are moving into our questions time. We do have about 30 or 40 minutes left to be able to answer questions. I know that there have been quite a few put into the chat. And so what we'll do now is allow you to raise your hand, get in the queue. You'll be able to come off mute and verbally ask your question, but we will also go back to the beginning of our Q&A and start reading through those questions, see if we can't give you any clarification on the points that we covered today. All right. Our first question, is electronic method an option for the homeless population? I'm going to let Rachel speak to this a little bit more. We did touch on it a little bit. So you cannot opt out of the hard copy mailed wellness education benefit in order to only receive something electronically. You do still have to receive the mailed copy of the benefit.
And I'll add, so we don't have an electronic only version, no version that's just emailed out, anything like that. But for the unhoused population, you can use any address they could pick their mail up from. So USPS has a lot of services like that. Some churches, other public entities offer services like that, and those addresses can be used for the web as well.
Thanks. And then I think our next two questions are pretty related. One of them is from Nicole. Will this benefit count against the SPAL for SLS clients? And then will the web benefit be billed on the PAR, because we haven't seen any web billing under CHCBS yet. So I'm going to let Rachel talk to those two questions also.
Yeah, so the web is going to be billed on the PAR. It will show up in that utilization section. It has not yet, just because our vendor is being enrolled as a provider in our system, and that's taking a bit longer than we would have hoped. So the vendor will have a year from when the services started to be able to bill those out. And they will be doing it monthly as soon as they're set up. So the webs are still going out as scheduled, and utilization will be appearing very soon.
And Rachel, can you talk about the cost per unit for how much it would be counting in their service plan?
Yes. So it's roughly $42-$43 per year. It's about $3.69 per month for each member. So the cost, we try to keep it as low as we can.
Awesome. Nora Hill, Luna, is asking, is this service that we want to promote? Nora, if you want to come off mute, you can, but I think you're asking, like, is this something that we want to be encouraging members to enroll in and sort of getting the word out ahead of time, maybe getting them enrolled in it at a monitoring visit or putting it on their PAR as a service plan revision, not just waiting till their CSR. And I guess what I would say is, yes, anytime we have a new HCBS waiver that's available to members, it's really important to tell them about it, right? See if it's something that they're interested in, if it's something that they want to be able to access. The wellness education benefit, again, is pretty pertinent as we go through our transition to CFC over the next 6 months. And so I would say promote it, right? It's a really cool benefit. It can be really exciting for members to receive. We think it's going to be very beneficial and useful for members. Rachel is asking to confirm we are not sending an initiation notice, PAR, or demographic face sheet to the web service provider when we enroll clients. Correct, Rachel. So there is a nuance here as it relates to the direct care type services that you're used to authorizing on your PAR. Because this is a mailed benefit, and we're working with our vendor and doing those data pulls, we do not need you to contact the provider directly. So that means you are not getting their signature on the service plan signature page. You're not needing to send them the PAR. You're not needing to give them a demographic face sheet. All of that type of information is going to be pulled from our systems through a data pull and provided to our vendor SmartSource for them to be able to initiate the mailing and targeted sending of the benefit to each member. Makes it pretty easier for you guys knowing that all you need to do is be adding this benefit to their service plan and putting it on their PAR, documenting in the CCM effectively. Then the members should be receiving the benefit.
And I just want to catch, there was a question lingering up top from Jenny. So we need to make sure they have 12 monthly web units. I have some that are getting less. So it's 1 unit per month. So say your member's waiver is expiring in 8 months, they would only be getting 8 units, and that's fine. You don't have to have the 12 for it to be added.
Yeah, you want to make sure that your units are lining up with your certification, the number of months within your certification. All right. Linda's asking, what are the CM next steps if a member is not receiving the web? Great question, Linda. So one of our slides, we talked a little bit about that returned mail process and the department receiving that information and providing it to your case management agency. In order for the web to be considered a monthly service, it's really at the point of mailing that it becomes counted. So when we have a returned mail and we notify you as the case management agency, again, the expectation is that you're working to try and update that address or determine why that mail was returned so that somebody can get the following month's mailing. If you're unable to reach that person, if you're unable to get an updated address, if you're unable to really get in touch with that person, figure out what's going on, and you've getting multiple returned mail notifications, then you need to start the case closure process if that person's not receiving any other waiver service. If they are receiving other waiver services, then you would treat that the same way you would treat any other discharge of a service, right? And send your notice for reduction termination of services. Because you can't get in touch with them for them to receive the service that's being authorized. If there's somebody who is voluntarily wanting to end the service, either they've gotten it, they don't like it, they just don't want to receive it anymore, then you don't need to send your notice because that's a voluntarily withdrawal of the service. Allison is asking, who would be the listed service provider? Our service provider, our vendor's name is SmartSource. Katie's asking, why would members want to stay on a waiver if the services that they utilize are covered by CFC? That's a really good question. And the answer is a little bit nuanced, but some members, you might have heard them referred to as maybe 300 percenters. They wouldn't otherwise be eligible for Medicaid if it weren't for the waiver, right? The waiver is what's allowing them to access, one, their waiver services, but then subsequently access state plan benefits. And that's not all of our population of waivered members, but there are some folks that are in that boat. And so the waiver is really a key factor in helping them maintain their financial eligibility to access other state plan benefits. If their services move to CFC, and that's the case for them, it may be the case that they're not actually eligible for CFC as a state plan benefit without having the waiver in place. And so we want to make sure that we can keep their waiver in place so they can then get CFC services that they're already used to receiving through their waiver. That's where that wellness education benefit is going to come into play to help them maintain their at least one monthly service for a waiver. And again, we'll go through CFC training here in the next couple of weeks and months, and you guys will get a lot of additional information. And so I appreciate your questions about CFC and some of the nuances and complexities of it. For right now, our focus is really like, look at this awesome benefit, and we're expanding it to all of our waivered members, not just our CHCBS population. So great brand new benefit availability across the state, and Let's see what members we can get enrolled into it and accessing the benefit.
We do have one hand raised. I didn't know if you wanted to take
Oh,
any.
sure. Yeah, we can mix it up and go to a hand raise. I didn't see that. Thank you. Looks like Irina.
Irina, if you accidentally lowered your hand, I'll give you another second. I did ask you to unmute, so you should be able to talk if that was an accident. Um, looks like you're unmuted, but we can't hear you. Oh, hand went down. Okay. Somebody else wants to. Sorry, Carly. Go ahead.
All right, Irina, if you change your mind. Oh, yeah, it was a little accident. Okay, if you change your mind, feel free to come off mute. Same with any other attendees. If you have a question you'd like to verbally ask, raise your hand. We'll take you off mute and you can ask. Michelle is asking, would the web benefit potentially keep people on waivers who could utilize CFC to meet their needs? And would this limit future enrollments? I don't know if I quite understand your question, Michelle, but yes, web can keep somebody on their waiver while they're accessing CFC. So it would end up being a dual enrollment. They would have their waiver open and their CFC and be getting some services through CFC, and then the wellness education benefit through their waiver, or other services that are available in the waiver that are not going to CFC. Nora is asking, was the service expanded due to the response from members already receiving the service? That's a great question. I don't know if, Rachel, you have anything to add about feedback we received from CHCBS members and how that could influence our decision to expand it to all members, but I will say it's been sort of in the works for quite some time for the wellness education benefit. Even since we released the availability to CHCBS members, we have always been working towards getting this benefit available to all members. We've just sort of incrementally released it, and that's what we're doing again here, is saying, okay, we've got it CHCBS members covered, we're going to expand to the rest of our population. It's a really great benefit for members, and we want to make sure all of the populations that we serve can access.
Yeah, and you really covered it, Carly. I think our hope was always to be able to expand it. And then when we saw success with the CHCBS population and positive feedback from stakeholders, it helped us to do that. So I'm very happy.
Yeah. Victoria saying some of her CHCBS waiver families report not receiving this in their mail. It might look like junk mail. Is there a way to be sure it stands out so not to throw it away by accident? Great question, Victoria. I would say a couple of things. One, if you have members who are saying they're not receiving their wellness education benefit and they should be, we need to escalate that up to that web inbox, because we want to be able to figure out what's happening for that member. Maybe there's a disconnect, maybe there's an issue with the address, not sure, but we want to look into it because we don't want members just not receiving the benefit that they're supposed to receive. Secondarily, if you remember in the examples that we showed you and the example that Rachel showed you, there's that purple banner at the top of the benefit. And it shows the Department of Healthcare Policy Financing Health First Colorado logo on it. It has that purple mountainscape on it and says wellness education benefit. That's going to be the identifying factor for your member that, hey, this is an important piece of mail. I'm not going to throw it away. And I would encourage you as case managers to explain that to them when you're enrolling them into the benefit. Say, okay, this is what you can expect. Look for that purple banner, look for the logo, look for wellness education benefit on that piece of mail so you don't accidentally throw it out, because certainly that is a very easy thing to do when you get a lot of different pieces of mail. Marilee is asking, will there be a brochure similar to the current brochures for the other waivers. And I think really you're talking about the Learn About LTSS website, which is also a really exciting new website with a ton of good resources on it. And I'll tout that whenever I can. There's brochures on there about the individual waivers. There's not a brochure about the wellness education benefit because the wellness education benefit is not a waiver in itself. It's just a benefit that's offered under our waivers. Those brochures that are out on that LTSS website are going to get updated to include wellness education benefit listed as a service at some point in the future. They haven't yet, but there's not going to be an individual brochure specifically for this service, kind of in the same capacity that we don't have individual brochures for any of our other waivered services. We don't have a adult day program brochure, personal care brochure, or homemaker brochure. The department is working though on its communication tools, educational tools, and the information that's put on our websites and on that LTSS webpage. So more to come, future state for some of those resources, but wonderful question.
I dropped the link to that website in case someone doesn't know what you're talking about, where those brochures, informational videos, enrollment guides for members. It's really a great resource. I went ahead and dropped that link in the chat for everyone.
Thank you. I would encourage you to everybody to use that website, share that website with your members, families, community partners. Lots of videos and brochures and resources on there, like Amanda shared with you. So thank you. I don't see other questions coming in or hands raised, but I'm going to give you all a few minutes to let some of this information settle in, think about it, if you have other questions. Oh, I see some hands coming up. Wonderful. Let's see if we can't have you come off mute.
I have unmuted. I don't want to say your name wrong.
Hi, can you hear me?
Ajane.
I think we hear.
Yeah, I think Ajane was first. If help me if I mispronounced your word or your name, sorry.
No worries. It's Ajane. You pronounced it perfect. What I kind of didn't catch in the beginning was when you list the services like personal care, and things like that.
Mm-hmm.
And basically, is that all those services are being moved to a different waiver? And the reason why I ask is I'm on ongoing side of my agency.
Mm-hmm.
So majority of the case, my caseload is clients who have elderly, blind, and disabled waivers. And those specific services that are listed on there, like HMA, personal care, homemaker, a majority of them have those. And so I'm wondering what happens to the elderly, blind, and disabled waiver, if I'm understanding it right.
That's a great question. And I'm not going to dive too deeply. I'm going to try and give you a shorter answer because we're going to have training specifically on community first choice coming up here in a couple weeks. I hope that you saw those training opportunities come your way and are registered for the CFC introduction training that's happening, and then know that there'll be some e-learning modules coming your way to go through the CFC process. But the move for these services that are on the screen over to CFC is not going to make it so that any of our adult waivers like EBD go away. All of our waivers will still be in effect. The difference is that they won't have all of the services under the waiver. So if you look at this list here, you'll notice that there are services that are offered in EBD that are not on the list, right? Those services are going to stay in EBD. They're going to stay in the brain injury waiver, the complementary integrative health waiver, mental health waiver. There are very specific services to those waivers. But these services will go into CFC. CFC is not considered a waiver in the way that our other waivers are, but you could kind of conceptualize it as a separate program. And you're going to probably have members that are going to be duly eligible and duly enrolled in their EBD waiver and then their CFC program. So their services will hopefully remain mostly the same that they're receiving, but they're just going to have basically two program types. One is their EBD waiver, one is their CFC, and then they'll get their service provision through both of those channels, and they'll stay on your caseload and you'll still do case management for them.
Thank you.
Rachel, I see your hand up.
Yes, my question was actually very similar. I was just wondering, which you kind of already mentioned, that the next trainings will go over this, but kind of like what is the main goal of this CFC and why are there these changes happening? Like if it's a different funding source and all of that.
Also a wonderful question, Rachel. And yes, we're going to cover that in the CFC trainings coming up. We are working at the department to make sure that you guys are getting the information that you need and getting it sort of in smaller bites at a time, because we don't want to overwhelm you. We know that there's big changes that are happening. And we're sort of building on the information that we're providing out to you each time that we're going to give you a training to help you put all of those pieces together. So I know some of it can maybe feel a little confusing right now because you don't have all of those pieces. I would encourage you all to go to the CFC website. That really gives you some of that high level big picture information about the why and all of the different components of CFC. But in general, Rachel, I can tell you there's a couple primary reasons. One, there is a different funding source. The department is able to get an enhanced match when we offer services through CFC instead of the waiver. So that helps across the board. It helps in so many different ways to have that additional funding, not just for the department, but for our providers, for our members, everyone. So that's a key component there. But additionally, what this does is really affords access to some of these services to population that we currently serve that didn't have access to them before. And you'll probably see this more highlighted in our children's population than our adult population. The opportunity for some of those children's populations to access things like personal care, homemaker, IHSS, CDAS is something they don't have access to right now. And with the implementation of CFC, they will end up having access. So we're really affording more people across our state and more of the population that we already serve access to more services.
Thank you.
Mm-hmm.
Can I just say too, Carly, I feel like our CFC team, the team that's been working on implementing and rolling out CFC, they work really hard to streamline it. So it's not, the assessment is shared, the prior authorization is shared. So if you're worried about it being a lot of extra work, it's actually not. A lot of things are kind of streamlined with it. So they did a good job, I think, trying to make it as seamless as possible.
Yeah. Thanks, Amanda. And I know, Kayla, you said disregard, I answered it, but I'll just give a point of clarification for the rest of the folks on the line too. Right, that case management expectations for CFC are the same as they are for waiver. So you're not going to have a different set of rules and responsibilities for CFC members than you do for your waivered members. Again, a lot of your members will probably be duly enrolled. Same requirements for you as a case manager. We don't expect that to make significant impacts and changes to your caseload, or if your organization chooses to change things up a little bit on how your caseloads are assigned and organized, that might be the case. But as far as the departments asking you to continue your case management, whether somebody's enrolled in HCBS or in the CFC, those requirements are staying the same. And then will this benefit be more crucial for SLS clients since their services are going to CFC? Not to say that DD waiver clients couldn't use it too. Joanna, another great question, right? So I'm going to say the wellness education benefit is impactful and beneficial for all of our members, regardless of which waiver they're on. DD members can access it, SLS members can access it. The services that somebody in DD receives, right? It's not the change to CFC. It's not as drastic as you're going to see for the SLS participants. So I don't want to say it's more crucial for one population over the other based on waiver. What's really important is that you're looking at what services that person is receiving, regardless of the waiver they're on, to determine that need. And also, again, the interest and choice that the member has to receive the benefits that they're getting. Thank you, Joanna. Great questions, y'all. Samantha, you're asking me if I can say the answer to the above questions again, but I don't know which questions you're referencing because of our Q&A structure. Could you maybe come off mute and let me know which answers you were thinking about? Who is managing CFC clients? Will this remain with their current case manager? So yeah, Samantha, your individual case management organization is allowed to work within themselves to determine how cases are assigned, right? The department doesn't dictate to your agency, you must assign this case to this case manager. What we do stipulate is your size of your caseload, and the fact that you need to be responsible for knowing our programs and services across the board. So some agencies are structured and organized a little bit differently than others. So what I can say is that the requirements for a case management are the same for CFC as they are for waiver. So if you have somebody whose services are going to CFC, that doesn't change the fact that that person needs an annual assessment. It doesn't change the fact that person has required monitoring, required service planning processes, PAR authorization. All the same things you do for your waivered member are going to be required for a CFC member. Your agency may choose to say we're going to have somebody with just CFC cases, somebody that has dually enrolled cases, somebody that only has waivers. Those decisions and operationalization of that is really going to be decided at your case management agency level. So I would encourage you to chat with your supervisor, your manager, to determine some of those nuances for you at your specific agency. Maritza is asking if these questions will be added to the web FAQ. Great follow-up. Yes, you're ahead of the game. We're collecting questions, answers throughout this training series that we've had for Wellness Education Benefit this week, and we'll be updating that FAQ, so you'll be able to use it as a resource in the future. All right, Michelle, you've got a question in here. In the case, a member is no longer eligible for a specific waiver with an end date prior to July 1, what complications might be involved in re-enrolling into CFC in July? if there's a gap and possible issue with financial eligibility because the specific waiver is no longer eligible. Wow, Michelle, that's a great question and pretty nuanced. And I think that it's probably primarily related to CFC. It's a little tricky to answer without knowing why they're not eligible for the specific waiver. Do they not meet level of care? Are they financially ineligible? Those things are factors. They're always going to be factors when you're enrolling somebody into a waiver or into CFC. No longer needing overnight care, so they're not meeting that targeting criteria for CES anymore. That's a huge factor. If they're not going to meet the targeting criteria for a waiver, then they're not eligible for that waiver. You have to start that case closure process. And fortunately, the wellness education benefit isn't a supplement to somebody meeting targeting criteria. They still have to meet their level of care requirements that are stipulated for all of our waivers. And then the targeting criteria that's specific to that waiver is also necessary to meet. If they don't have that eligibility, the wellness education benefit isn't going to supplement that.
And I don't know if we want to go down this rabbit hole, but man, I feel like you should definitely bring this question again to the CFC training, because it's an excellent question. And there's some nuances there that we can talk about when we're really diving into the CFC process. So in March, first week of March, be there, bring your questions. And
yeah,
I
for
would
sure.
love to
This
dive
could
into
be
this more.
it could be a situation where CFC only would be applicable if the CES child has the appropriate financial eligibility determination. They may be able to just be a CFC only client in the future, but they'll still have to have that eligibility process completed for their financial eligibility. And for CFC, members do have to meet a level of care. There's not the specific targeting criteria for CFC, which is also a really great benefit. So it's possible that child might end up being able to receive those CFC services, but those nuances would have to definitely be looked at with their financial criteria. And the enrollment process is going to be very similar to what you do for waiver enrollment, right? You still have to do your level of care, still have to do your service planning. You're still going to have to get some service authorizations from vendors. So more to come in those CFC trainings for sure. All right, guys, I want to thank you so much for joining us this afternoon. You guys have been a pleasure, and I really appreciate all of your thoughtful questions. That will conclude our wellness education benefit training. Again, this training can be accessed through our LTSS training website. In the next 2 weeks, we'll have a posting up there for you and additional resources. I appreciate your time and energy this afternoon and learning about this new benefit. Thank you so much.